Okay, good day everyone, and to all our viewers from all over the world. First and foremost, I'm grateful for having been invited to participate in this fourth scientific summit on tobacco harm reduction. I commend this much awaited event for the laudable effort to bring to the fore the real narrative and science about tobacco harm reduction. Before I proceed, allow me to introduce myself. I'm Dr. Lorenzo Mata, a concierge medical doctor and a general practitioner who does house calls, catering to approximately 90,000 people around a certain part of the beautiful scenic highlands of Antipolo City, Philippines, where I live. I'm also the president of Quit for Good. Today, I shall talk about tobacco harm reduction in the context of the Philippines, my home country. But before I proceed, let me give you a brief background about my organization. Quit for Good is an advocacy group composed of concerned citizens who recognize the profound damage and loss tobacco has brought to society. We in Quit for Good advocate real, practical, and tangible solutions that seek to eliminate once and for all the world's leading cause of preventable death and diseases, the combustible tobacco. We also advocate smoking cessation through consumer education on alternatives to smoking and fair regulation, and that strives to build a coalition and a neutral space in pursuit of the same. I have been very visible in different public fora through our Quit for Good podcasts. I attend legislative hearings as resource speaker and participate in media interviews explaining the benefits of vaping to smokers and why these products are necessary as a considerably less harmful alternative for them. In addition to this, we also submit position papers to the government where we raise issues from the perspective of the 70 million Filipino smokers we are trying to help and push for a differentiated, balanced, and consumer-centric approach to regulating smoke-free products. In line with our efforts and advocacies, we have been strong believers of the concept of tobacco harm reduction. Harm reduction as a general idea is defined by the global 2021 Global State of Tobacco Harm Reduction report as a range of pragmatic policies, regulations, and actions which either reduce health risks by providing safer forms of products or substances or encourage less risky behaviors. According to the report, tobacco harm reduction or using safer nicotine products offers new choices to millions of people worldwide who want to switch away from smoking or other dangerous forms of tobacco use, but have been unable to with the options previously available. Now, why is tobacco harm reduction relevant to the Philippines? Here are the statistics. According to the 2015 Global Adult Tobacco Survey, there are almost 17 million smokers in the country. The same survey showed that while some 76.7% of current smokers plan to or thought about quitting, only 4% of those who smoked in the past 12 months successfully quit in 2015. That's a measly quit rate which largely remained unchanged from 2019. Lastly, the 2019 Global Burden of Disease report from the University of Washington revealed that a shocking rate of more than 117 million Filipinos die each year due to tobacco smoking. Uh, in as much as we want all smokers to quit, in reality, not everyone would want to quit. We in Quit for Good put forward that the traditional quit or die approach to public health must be abandoned immediately. A third option must be available to our adult smokers who do not wish to quit. Tobacco harm reduction through the use of promotion of safer alternatives to combustible tobacco should be employed to substantially reduce the risk of death and disease of smoking. So what are the better choices? One solution is electronic vaping products or electronic cigarettes that do not involve combustion. Beyond any reasonable doubt, vaping is considerably less harmful than combustible cigarettes. Almost all the harm done by cigarettes arises from the smoke, which is caused by combustion. Vaping does not produce smoke, only vapor. Another alternative to combustible tobacco is what we call the heated tobacco products or HTPs, as reported by the 2018 Global State of Tobacco Harm Reduction. HTPs work on the principle of heating tobacco below the level of combustion. Similar to e-cigarettes, there's no burning, but unlike vapes, nicotine is naturally found in tobacco. By heating the tobacco without burning it, HTPs only produce vapor. Vapor products and HTPs are not completely risk-free, but studies such as those conducted by Akiyama et al. In 2021 and Rodrigo et al. In 2020 show that the use of electronic cigarettes and heated tobacco products could lead to significant reduction in exposure to harmful substances compared to combustible tobacco cigarettes. Allow me to remind everyone, however, that the best way to avoid the harms of cigarette smoking is as simple as quitting completely. Ultimately, to achieve the public health goals of accelerating the decline in smoking prevalence and reducing the harm related to it, harm reduction measures must be mainstream in the regulatory policies of the government alongside public awareness and education. Adult smokers should have the option to switch from smoking to other alternatives that do not involve combustion, such as electronic cigarettes and HTPs. Allowing adult smokers who do not quit to have access to alternative products can actually support current and future regulatory measures against smoking combustible cigarettes. So we envision an effective regulatory framework incorporating harm reduction measures to be differentiated, less restrictive than combustible cigarette regulations, supportive of reasonable accessibility and product communication, while curbing unintended use of non-smokers and minors. Laws should be revisited and carefully calibrated to ensure that adult smokers are made aware of the less harmful alternatives available and given the option to shift to these alternatives while minors and non-smokers are protected. Over-regulating these better alternatives to the point of impossibility of compliance would only perpetuate smoking. Now, on our Philippine experience with the current and pending regulations governing vaporized nicotine products. At present, the Philippines does not have a comprehensive, differentiated, and defined framework for the regulation of vapor products and HTPs. The existing national regulatory regime on tobacco use is inadequate, piecemeal in nature, and does not sufficiently embrace the principles of tobacco harm reduction. In 2019 and 2020, new tax laws such as RA 11346 and Republic Act 11467 were passed into law, which recognized the different classifications of e-cigarettes and HTPs from combustible cigarettes because they do not produce smoke by adopting separate definitions. We have recently witnessed a breakthrough in the global campaign to mitigate the impact of smoking in terms of Philippine legislation. We have a bicameral legislative system in the Philippines. We have the House of the Representatives and the Senate. In the House of Representatives, they already passed House Bill number 9007 or the Non-Combustible Nicotine Delivery System Regulation Act, as May 25, 2021. The bill regulates the manufacture, sale, use, and of less harmful alternatives to cigarettes, such as vapor products and HTPs. It expressly declares as a policy of the state to consider harm reduction measures as a public health strategy by ensuring that non-combustible alternatives to cigarettes are properly regulated. On the other hand, the Senate is currently deliberating their own version of the Vape Bill or Senate Bill 2239, also known as the Vaporized Nicotine Products Regulation Act. We support this bill because Senate Bill 2239, also known as Vaporized Nicotine Products Regulation Act, is a policy of the state to enact a balanced policy whereby these novel consumer products are properly regulated using internationally accepted product standards in order to protect the citizens from the hazards of unregulated and substandard vapor products and heated tobacco products while ensuring that access to this non-combustible alternative is not curtailed. If the Senate bill is passed, both houses will come up with a consolidated bill for the President's approval. Now, as to the current challenges, obstacles in differentiated and balanced regulation, we are optimistic that public health goals can be achieved with the right support and cooperation from the stakeholders, such as the government, industry, and consumers. But the journey towards acceptance of tobacco harm reduction in the Philippines and a better regulatory framework is no easy feat. Based on media statements, the Department of Health has reiterated its position that electronic cigarettes should be treated and regulated no differently than other tobacco products, and that there is absolutely no acceptable level of harm, especially when Filipinos or lives of Filipinos are put to risk. The Health Secretary publicly stated that the nicotine-containing e-cigarettes and HTPs are harmful products that should be regulated to enforce sensible public health standards and protect the health of the people. The Department of Health has also publicly called for a ban on e-cigarettes. So as regards to the consumer insights, there's a good news when it comes to the attitudes of adult Filipino tobacco and nicotine users. A survey conducted by Acorn Marketing and Research Consultants among 2,000 adult smokers and nicotine users showed that 9 out of 10 smokers and users of smoke-free products want the government to come up with plans to enforce tobacco harm reduction in the country. The poll also revealed that 94% of the respondents agreed that the government should enact policies to encourage adult smokers to switch to less harmful alternatives to cigarettes, while ensuring that the products will not be used by minors. Another key finding is that 70% believe electronic cigarettes and HTPs are better alternatives to cigarettes, and 88% of adult smokers would consider switching to these products. Okay, so then what are the steps for our organization Fit for Good in the Philippines? It's high time that the government re-examine its current tobacco regulations and seriously consider measures promoting the acceptance of smoke-free products in the country. It is only
Lorenzo?
when we provide adult smokers less harmful options that we rightfully shift the balance in favor of the individual for a more inclusive public health policy. So, having imparted our views on tobacco harm reduction in the context of the Philippines, we are pleased to share with you the next steps for our organization, Quit for Good. We will continue capacity building for our advocacy group and enticing new members, which are actually steadily on the rise. We will also initiate local research and surveys on smoking and vaping information. We will continue to educate smokers on all available options for quitting via our regular live stream, podcasting, and media forum engagements. We will likewise continue to monitor and advocate the passing of the national bill on e-cigarettes and HTPs into law. In line with this, we urge the government to consider the best possible differentiated legal framework to careful review of the science and evidence presented on the matter and defend the right of the consumers to make better choices for themselves. This concludes my talk. Thank you very much for this opportunity. So let's
Thank
be
you very
informed, stay
much.
informed, and help inform life.